After accessing the patient electronic medical record, click the Assessment button to access the forms. The Initial Nursing Inpatient Assessment provides initial patient assessment upon admission and baseline monitoring of patient improvement or deterioration after admission. It should be done immediately upon admission and to be completed before the end of shift, except for critical areas. Enter the code 1187 for Initial Nursing Inpatient Assessment or type name of the form. Enter the date and time it is conducted. In the admission section, enter the data accordingly. Leaving blank spaces mean that the criteria is not applicable to the patient. In the source of information, select who gave the information, the patient, family, or caregiver. Tick Other if the data came from a person other than listed in the choices, and provide the appropriate data. Select the mode of transport if it is ambulatory, via wheelchair, stretcher, or carried child. Then select where the patient came from: home, ER, OPD, or other, such as direct acceptance from another hospital. Enter the chief complaint of the patient. The next section is about allergies of the patient. Fill up the following details and choose between yes or no and indicate who provided the information. If yes, specify the kind of allergen. Don't leave any blank. The next section is about the history of infection of the patient. Fill up the following details and choose which specific infectious disease the patient has been exposed. Put an A if not applicable, don't leave any blank. Then in the precaution, select which precaution is applicable for your patient. Indicate the organism and site if there is a confirmed presence organism. For the patient-owned medication, indicate where did the medication has been kept. For the patient valuables, select whether it's been sent with the family, in the hospital safe, kept by patient, or if others specify the details. In the pain screening, tool use/result, select the appropriate tool for pain screening and fill up the appropriate tool used. Select the appropriate tool for fall risk assessment. An initial fall risk assessment must be carried out by the registered nurse utilizing the Initial Nursing Assessment for within 2 hours of admission. Tick is appropriate based on the score. For the vital signs section of the form, most of the time the data are already provided based on the initial vital signs taken. But if vacant, fill up the vital signs accurately. The vital signs is filled up based on the measurements taken if the patient was seen initially in ER. In other cases, fill up the space for vital signs. Skin assessment must be done upon admission. Fill up the Braden scale form. Assess the general skin condition of the patient and tick appropriately. If a pressure injury is present, fill up the wound assessment form. For the nutritional screening section, tick the boxes based on your findings. If any of the boxes are ticked, referral must be done to the dietitian. If the dietitian has been notified, tick yes. If the options are not applicable to the patient, tick not applicable. For functional screening, check the ability of the patient to perform activities of daily living such as feeding, bathing, toileting, dressing, ambulation, dressing, vision, speech, hearing, mental cognition, and if the patient uses mobility aid. Determine if the activity can be performed independently or needs assistance or dependent on another person. If any of the criteria needs assistance or dependent, tick yes and refer to the physician. Tick an A if it's not applicable. In the psychosocial screening, check the patient's psychological and emotional status. No for any of the following such as emotional problem like depressed, anxious, or sad. Behavioral problem such as uncooperative, withdrawn. Social or family problem. Financial problem. Suspected abuse. If there is anything in the patient's cultural or religious background that is needed to plan his care, specify in the space provided. If the patient meets any of the following criteria, notify the appropriate discipline. In the early discharge planning section, begin immediately upon admission, including preparation for education and/or equipment. Select the criteria according to the discharge plan. Does the patient need special education needs after discharge? Does the patient needs requires changes in the environment after discharge? Does the patient needs continued nursing/medical needs after discharge? Then in the space provided specify the plan for your patient. Lastly, you need to select from the options which was done as part of orientation provided to your patient. Environmental orientation is an important part of the initial nursing assessment because this will improve patient safety, will prevent future complaints or confusion to the patient or relative. The following things that you need to explain: how to use the lights, telephone side rails, call light, TV, bathroom alarm, bed control. Where to is the Qibla emergency exits. Proper timing for mealtime, visiting time. Smoking policy and infection prevention precaution. After completing the form, don't forget to click the Save button. Thank you.